Welcome. If you are a woman over 60 or care about someone who is, this message is especially for you. Your life journey has been rich with experiences, joys, challenges, and growth. Now, in this vibrant season, it's time to focus on you and your health. One critical area often overlooked is breast health. Many women believe that once they pass menopause, the risk of breast problems decreases or that breast cancer always presents with obvious symptoms like lumps or pain. Sadly, that's not the case. Breast problems, including cancer, often start quietly, whispering subtle clues before anything obvious appears. These silent signs are easy to miss but crucial to catch early. Ignoring them can mean missed opportunities for timely intervention and better outcomes. In the next few minutes, we'll explore 5 silent signs of breast problems that every woman over 60 should never ignore. We'll unpack each sign with detailed explanations, personal stories, and practical advice on what to do if you notice them. This isn't about scaring you, it's about empowering you. When you know what to watch for, you become your own best advocate for health. So, take a deep breath and let's embark on this important conversation. Your body speaks. Are you ready to listen? Silent sign number 1, unexplained changes in breast shape or size. As we age, our bodies change naturally. Breasts can become less firm, sometimes smaller or more droopy. These are normal changes caused by hormonal shifts, loss of skin elasticity, and changes in fatty tissue. However, there is a difference between natural aging and sudden or uneven changes in your breasts that demand attention. Imagine waking up one morning and noticing that one breast looks noticeably larger or fuller than the other. Maybe it feels heavier, or the skin looks stretched in one area. Or perhaps one breast shrinks or changes shape while the other stays the same. These are not just cosmetic concerns, they could be silent signals that something is happening inside. Why does this happen? Changes in size or shape can be caused by growths, whether benign cysts or tumors, or inflammatory processes. Breast tissue itself might be affected by fluid buildup or structural changes caused by underlying disease. Let me share a story. Mary, a 65-year-old grandmother, thought her uneven breast size was just part of aging. She ignored it for months. Eventually, she noticed skin dimpling and went for a checkup. Tests revealed an early-stage breast cancer that had started to affect the tissue. Because she caught it before it spread, her prognosis was good, and treatment was less invasive. What to do if you notice changes? Regularly examine your breasts in front of a mirror, with arms raised and relaxed. Compare both sides for asymmetry or sudden changes. Don't ignore swelling, fullness, or shrinkage that appears overnight or develops quickly. Make an appointment with your healthcare provider immediately if you notice these changes. Remember, early detection is key. Uneven changes are a loud whisper your body sends. Listen carefully. Silent sign number 2, skin texture changes, puckering, dimpling, or scaliness. Our skin is often the first place a health problem shows up. When it comes to breasts, subtle skin changes can be a critical early warning. Have you ever noticed the skin of your breast starting to look like the surface of an orange peel? Or maybe it seems puckered or dimpled, almost like tiny dents or craters. Sometimes, the skin might become thickened, red, or even scaly in patches that won't go away. These changes might look like a rash or irritation, but unlike a typical rash, they don't fade or respond to creams. Why are these changes so important? Because they can signal inflammatory breast cancer, a rare but aggressive form of breast cancer that tends to progress quickly. This type of cancer causes swelling and redness by blocking lymph vessels in the skin, leading to the textured appearance. Skin dimpling can also happen if a tumor tugs on the tissue beneath the skin. Linda, a 62-year-old artist, noticed a red patch with rough skin on her right breast. She thought it was eczema and tried creams. When it didn't improve, she consulted her doctor, who performed a biopsy. It turned out to be inflammatory breast cancer. Because she acted quickly, she began treatment early. How to recognize skin changes. Look for puckering, dimpling, or thickened skin that resembles orange peel texture. Note any persistent redness, warmth, or rash-like areas. Don't dismiss scaliness or crusting, especially near the nipple. Keep track by taking photos if possible, so you can notice progression. When to seek help. If skin changes persist beyond a week without explanation. If accompanied by swelling, warmth, or pain. If you see sudden redness spreading on the breast. Your skin can reveal a lot. Treat these signs seriously and don't delay medical consultation. Silent sign number 3, unusual nipple changes, retraction, discharge, or pain. The nipple may seem like a small and insignificant part of the breast, but it can tell you important things about your breast health, especially after age 60. Changes to the nipple that are silent but significant should never be ignored. Some women notice their nipples suddenly turning inward or becoming pulled back, called nipple retraction or inversion, when they previously pointed outward or were flat. This can be a sign that something beneath the surface, such as a tumor or scar tissue, is pulling on the ducts. Unlike the common and often benign nipple inversion present from birth or long-standing, sudden changes need attention. Another silent signal is nipple discharge that appears without squeezing or stimulation. This discharge might be clear, milky, yellowish, or even bloody. Although not all discharge means cancer, bloody or watery discharge that persists is a red flag. Nipple pain or tenderness without an obvious cause, like trauma or infection, can also be a subtle warning. Pain that persists, especially if localized to one nipple or breast, deserves investigation. Consider the story of Joan, a 68-year-old retiree. She ignored a small amount of bloody nipple discharge for months, thinking it was from dry skin or irritation. Eventually, she noticed the nipple had started to retract slightly. A visit to her doctor and subsequent tests confirmed ductal carcinoma in situ, CIS, an early, non-invasive breast cancer. Early detection meant she was treated successfully without needing extensive surgery. What to watch for in nipple changes. Sudden inversion or pulling back of the nipple. Any persistent discharge, especially if bloody or clear and watery. New or unusual nipple pain or tenderness. Changes in nipple color, such as redness or darkening. Steps to take. Don't wait, see your healthcare provider promptly if you notice any nipple changes. Your doctor may order imaging tests like mammograms or ultrasounds. They might perform a nipple discharge cytology or biopsy if needed. Remember, your nipples are an early alert system. Respect what they tell you. Silent sign number 4, persistent breast or underarm lumps or thickening. Lumps are often what people immediately think about when it comes to breast cancer. But the silent ones, the ones that don't hurt or cause discomfort, are the most dangerous because they are easy to overlook. At age 60 and beyond, the breast tissue becomes less dense, making lumps easier to detect if you're vigilant. But many women either stop performing regular breast self-exams or dismiss lumps as harmless cysts or scars from past injuries. The key here is persistence and change. A lump or area of thickening in the breast or underarm, axilla, that remains for more than 2 weeks, grows, or feels different from surrounding tissue should never be ignored. Underarm lumps can indicate swollen lymph nodes, which may be a sign that breast cancer cells are spreading beyond the breast. Helen, a 70-year-old avid gardener, discovered a small lump under her left arm. Because she felt fine otherwise, she waited. The lump grew, and she started feeling fatigue and night sweats. When she finally saw her doctor, imaging and biopsy revealed invasive breast cancer with lymph node involvement. Her treatment was more aggressive because of the delay. How to perform a thorough check. Use the pads of your fingers to gently press all around each breast and under the arms. Look for any hard lumps, thickened areas, or irregular shapes. Note any lumps that feel different than normal breast tissue or don't go away. Do self-exams monthly and report any concerns to your doctor promptly. Why early detection matters. Early-stage lumps are often easier to treat. Identifying lymph node involvement early can improve treatment options. Persistent lumps might be benign, but it's better to be safe and check. Summary so far. We've explored the first 4 silent signs. Unexplained changes in breast size or shape. Skin texture changes like dimpling or scaliness. Nipple changes including retraction and discharge. Persistent lumps or thickening in the breast or underarm. Each of these signs is subtle, sometimes painless, but potentially life-saving if detected early. Silent sign 5 plus lifestyle strategies for breast health after 60. Silent sign number 5, unexplained breast pain or discomfort. Many women dismiss breast pain, especially after menopause, as normal or due to hormonal changes. However, unexplained, persistent breast pain or discomfort, especially if it affects only one breast or is a new symptom, can be a silent sign of an underlying breast problem. Breast pain that lasts for weeks, or is accompanied by other symptoms like swelling, redness, or lumps, should never be ignored. While breast pain is less commonly a symptom of breast cancer compared to other signs, it can be associated with infections, mastitis, cysts, or, in rare cases, inflammatory breast cancer. Some women experience a deep, aching pain or sharp localized pain that doesn't correspond to their usual monthly cycles. For women over 60, whose hormonal cycles have changed, pain unrelated to any pattern is particularly suspicious. Take the case of Elaine, a 63-year-old retired teacher. She felt a persistent ache deep in her right breast that didn't go away for over a month. At first, she thought it was muscle strain from gardening. But when the pain increased and was accompanied by subtle skin thickening, she consulted her doctor. Further tests revealed early-stage inflammatory breast cancer. What to watch for with breast pain? New, persistent pain affecting only one breast. Pain accompanied by other signs like redness, swelling, or lumps. Pain that worsens or does not improve over time. Pain without clear cause like injury or infection. What to do? Keep a symptom diary noting pain intensity, location, and any associated changes. Consult your healthcare provider promptly for a thorough examination. Don't self-diagnose or ignore persistent discomfort. Taking charge, lifestyle strategies for optimal breast health after 60. Awareness of silent signs is critical, but your daily choices matter just as much in protecting breast health. Let's explore practical, research-backed strategies to empower you in nurturing your breasts and overall well-being. 1. Nourish with an anti-inflammatory, breast-friendly diet. Chronic inflammation creates an environment where diseases, including cancer, can thrive. Eating anti-inflammatory foods helps combat this quietly damaging process. Focus on berries like blueberries, raspberries, and strawberries, rich in antioxidants. Leafy greens such as kale, spinach, and collard greens for their nutrient density. Fatty fish like salmon and mackerel, high in omega-3 fatty acids which reduce inflammation. Cruciferous vegetables, broccoli, cauliflower, that support estrogen metabolism. Nuts and seeds including walnuts and flax seeds for healthy fats and fiber. Limit or avoid processed and red meats linked to increased cancer risk. Sugary snacks and drinks that spike insulin and inflammation. Excessive alcohol, which can disrupt hormone balance and increase risk. Hydrate well with water and herbal teas to support detoxification and tissue health. 2. Stay active. Movement is medicine. Physical activity is one of the most effective ways to lower breast cancer risk and improve overall health. Aim for at least 150 minutes per week of moderate aerobic exercise, walking, swimming, cycling. Strength training twice weekly to maintain muscle mass, support bone health, and balance hormones. Mind-body activities like yoga or tai chi to reduce stress and promote circulation. Even gardening, dancing, or brisk housework counts. The key is consistency. 3. Maintain a healthy weight. After menopause, fat tissue becomes the primary source of estrogen, and excess fat can increase breast cancer risk. Work with your healthcare provider to set realistic weight goals. Adopt gradual lifestyle changes for sustainable weight loss. Monitor waist circumference as abdominal fat is especially risky. 4. Prioritize quality sleep. Sleep restores and regulates hormones and immune function. Tips include: create a cool, dark, quiet sleeping space. Stick to a consistent bedtime and wake time. Avoid screens and caffeine before bed. 5. Manage stress and emotional wellness. Chronic stress can suppress immunity and fuel inflammation. Use strategies like meditation and deep breathing, journaling or creative expression, social connection and professional support. 6. Stay up to date with screenings. Don't skip mammograms and clinical breast exams. Schedule mammograms annually or as advised. Report any new or unusual symptoms immediately. Develop a trusted partnership with your healthcare provider. 7. Discuss hormone replacement therapy, HRT, wisely. If considering HRT for menopausal symptoms, understand risks and benefits with your doctor. Explore alternatives or lowest effective doses. Regularly review therapy duration and necessity. Final thoughts: empowerment through listening. Breasts speak to us in quiet ways. Changes in size, texture, nipple appearance, lumps, or pain are messages worth hearing. For women over 60, being proactive, vigilant, and informed transforms silent signs from scary unknowns into opportunities for early care and better outcomes. You have the wisdom and power to care for your body. Never ignore what it's trying to tell you.